Right.
So 10 seconds will go like, no? Okay, so you can start. Boy.
Yeah. Is my voice audible? All right. So we will be discussing via what we breathe. Basically, we are dealing with asthma as such. Okay. Right. So just 1 minute. Right. So we will be discussing with you regarding insights in asthma. So asthma is a fairly common disease. It is a heterogeneous group of disorder characterized by cough, wheezing, breathlessness, and chest tightness, which vary over time, and it is a disease characterized by variable airflow limitation. So, what is this medical jargon about? So, let me simplify this. So, to put it in a simple term, basically, our airways are having hyper responsiveness to some exogenous allergen or some triggering factor which leads to narrowing of airways, which causes difficulty in breathing, cough, and a musical sound which we say it as wheezing, right? And chest tightness. So, how much common is this disease? This disease is fairly common as per the studies which are done in Europe, done by International Association of Allergy and Asthma, and as per US and UK census. The incidence and prevalence varies over various regions. It is different in Southeast Asian region, somewhat different in Mediterranean region, and different in USA. So, in broad terms, the prevalence of asthma ranges from around 3% to 27%. On an average, if you have to take a ballpark point figure, out of 10 people, 3 people are suffering from asthma. So that's quite a huge number. If we consider census of India as 140 crore people, so imagine that 3 people per 10 people, you can guess the number, such a huge number. So there are so many patients of asthma which are there. And the asthma, it varies over time, and at different age it is manifesting differently. So there is something like childhood asthma, there is something like adult onset asthma. In childhood asthma, most of the individuals, they grow out of their asthma. However, in adult onset asthma, which happens after teenage or maybe in the perimenopausal group or in 30-40 age group, it kind of sticks. So the symptoms are quite persistent. The severity of asthma is more. So adult onset asthma needs some more care as compared to childhood asthma. Uh, this is a rough estimate. What and how do we diagnose asthma, and what are the risk factors for it? So the risk factors for asthma, number one will be smoking. Number two is genetic predilection or genetic tendency. If your mother or father is suffering from asthma, there is a high risk or high chance that you may also develop asthma sometime in your life, which is something known as allergic march. What is allergic march? It starts with allergic rhinitis. It moves down, goes into your throat or something like lungs, and it develops like asthma. So it's a simply, you put it like asthma, allergic rhinitis, skin manifestation like eczema, or any other allergic tendency. All are spectrum of having uh, what we know as a T2 phenomena or TH response, which causes allergic phenomena, and which is known as asthma. Okay, so what are the air pollutions and environmental triggers which are there? So environmental triggers include change of place or change of atmosphere. Usually winter season, or particularly this season from October, November till February, most of India is having winter season. So people who are having asthma, they exacerbate during this period. Apart from environmental triggers, there are factors like indoor and outdoor pollution. In indoor pollution includes dust mite, pet exposure, strong scent or perfume, some construction site dust, or any other indoor pollution which is there. And outdoor pollution, we all know that some noxious particles, airways, which go in airways, gases such as SO2, HO2, which we know as PM 2.5, particulate matter 2.5, which directly goes in the lung and causes irritation and which can predispose one to asthma. These are environmental triggers which are there. How do we avoid and what to do about that? We will deal it with later. Now let's come to sign and symptoms of asthma. So the most common symptom which a patient will present with for asthma is long-standing cough, which is mostly dry, irritating, usually more at night time, so much so that the night sleep is disturbed. And because of the night sleep is disturbed, daytime the quality of life is quite hampered. And all this is a vicious circle. Nighttime coughing, daytime coughing, decreased quality of life with chest pain because of recurrent cough, and usually associated with a musical sound which is wheezing. And these intensity of symptoms this vary over time. So there might be some period where patient is absolutely normal, there are no symptoms. Usually in summer season, patient might be absolutely well and absolutely fine. However, whenever there is exposure to some trigger, that trigger can be anything. That can be, as I mentioned, dust or any other, probably a food allergen, probably a aero allergen or any other type of allergen. Or without allergen also, there can be exacerbation of asthma symptoms. Now, with these signs and symptoms, now that we know, how do we actually diagnose asthma? So we diagnose asthma with the basic test known as PFT, which is pulmonary function test. In pulmonary function test, the individual has to blow hardly in a machine, and that data is analyzed by computer, and it gives us values that how much your lung is working and what percentage of your lung is damaged. And after that what we give is something known as inhaler, that after giving inhaler we try to repeat the test and we see whether the lung capacity is increasing. So if there is a increase of 10 to 12% from the baseline value, we say that there is bronchodilator reversibility. And with that bronchodilator reversibility, you are more sure to make a diagnosis of asthma. Now, the reversibility can happen in other disorders as well, like COPD. However, this bronchodilator reversibility is kind of somewhat specific towards asthma, and you definitely have a background of clinical history. Putting it all together, clinical history plus PFT, there are some blood markers as well, such as raised eosinophil count in blood or raised total IgE levels, which can give us a diagnosis of asthma with more confidence. So, what happens when an individual is not able to do PFT? Because PFT is a effort related test. Some patients may not be able to blow properly. Some may be small children who are not able to do. Some may be elderly population who are not able to do. So what do we do that? So there is something known as impulse oscillometry, which is a different device in which the machine itself will analyze the data. It sends sound waves inside, and with the use of physics, the resistance, the reactance, and the capacitance and all the other things. It tries to calculate how is the lung working. And similarly, we give bronchodilator in that, and we see reversibility, whether the resistance in the lung, small airways or the large airways or both, whether it is reducing or not. And that helps us in making diagnosis of asthma. Now that we have made a diagnosis of asthma, it can be a OPD diagnosis, or a patient can land up in emergency when there is exacerbation of asthma. Anyways, whenever we think that patient is having asthma, we need to treat it. So how do we treat it? So the two pillars of treatment are: number one is symptom control, number two is allergen avoidance. So regarding symptom control, you need to assess the severity of symptoms. So how do we assess severity of symptoms? Severity of symptoms simply means that how much of your quality life is damaged. How is your work productivity? Are you able to concentrate in your work? Is a child able to go to school properly? Is there any absenteeism? Is a child able to play properly? In adults, are you able to work properly? Are you able to concentrate properly? Are you feeling good out of 0 to 10 scale? How much fresh do you feel in morning? So all those things tells you about the symptoms. Second thing, the most important thing is about nocturnal symptoms, right? In nighttime, whether the patient is having asthma or not, whether it is increasing or not. So that tells about the severity. If patient is waking up at nighttime and there is a disturbed sleep, it usually indicates that patient is having severe asthma. Apart from daytime symptoms, nighttime symptoms, do you use inhalers? In inhalers, there are two categories mainly. One is known as reliever and one is known as a controller. So a reliever is usually a drug which is gives you a quick relief, but the problem with that reliever is that the effect is temporary. It is not sustained. And one of the symptom of uncontrolled asthma is increased use of reliever medications. So patient has to take recurrently reliever medications, and despite that the symptoms are not controlled, then that is classified in a severe kind of asthma. So broadly speaking, we divide asthma in symptoms such as whether it is mild, moderate, or severe, whether the symptoms are intermittent or persistent. And accordingly, there is a classification of mild intermittent, moderate intermittent, or persistent, severe intermittent, or severe persistent. Usually, patients will fall in moderate intermittent or severe intermittent category. The beauty of asthma and also a sad thing of asthma is that the symptoms are variable, right? So in between, patient can be absolutely normal. So what usually does when one is normal, they will not like to take medicine, and you don't take medicine, which is inhaler, it can lead to further exacerbation of your symptoms. So in between periods when patient is absolutely normal, usually patients don't take inhaler, and because of that, there is an increased risk of exacerbating asthma. Why we are worried about exacerbation? What is that which happens? So usually lungs, they decline at 70 to 80 ml per year. Our lung capacity is limited. Some may have a lung capacity of 2.5 liters, some may have 3 liters, some may have 3.5 liters. It usually is around 2.5 to 3 liters. So every year there is a decline of 70 ml after the age of 18. With each exacerbation, it causes lot of stress, lot of inflammation in the lungs, and there is a rapid decline of lung. So the ratios which we are obtaining from pulmonary function test, the most common ratio which we see is the FEV1 by FVC ratio. That is usually lower in asthmatic patients, and it declines faster when patient is exacerbating or is having exacerbation. Along with exacerbation, the point is that it puts immense pressure, social burden, economic burden, and overall burden on family that patient is unwell or he or she is suffering from asthma. Whenever we know that patient is having moderate or severe asthma, it is mandatory to take inhalers in a proper prescribed dosage format with proper inhaler technique. Usually, whenever we tell about inhalers, the point number one is to teach inhaler technique. As per studies, it is found that around 50 to 70% of patients don't take their inhalers properly, and remaining 20-30%, whoever are taking inhalers properly, they also try to stop in between, or they feel better, they stop it. So the way I like to explain is that asthma is like any chronic disorder, like diabetes, like hypertension, like thyroid, where you have to take your medicines for long time. And as you take your medicines, if you are better, doctor will try to reduce your inhaler dosage. Now, other concern with inhaler which usually patients have is that it contains steroid. So yes, it contains steroid, and the steroid is labeled as inhalational corticosteroid. The worry about all the patient is that steroid, it's a damaging thing. Inhalers, we will get habituated. Inhalers are not good for health. It is something like very serious. So to give a perspective on that, inhaler dosage is in micrograms. So how do we measure microgram? So suppose we have 1 kg, you divide it into 1000 parts, it becomes 1 gram. You have 1 gram, you divide it into 1000 parts, it becomes milligram. 1 milligram, you divide it into 1000 parts, it becomes microgram. So the dosage of inhaler of inhalational corticosteroid is usually in micrograms, 200 microgram, 250 microgram, 400 microgram, which is quite a minuscule, a very small dose of inhaler, and usually it goes directly in lung. So the systemic side effects are less, and it acts better, faster, and gives you more sustained control over your symptoms. So, inhaler, if you have the technology, if you have a proper inhaler device, and it is causing less side effects, less systemic absorption, why not to take it? The other concern, which usually parents have, that their child may have stunted growth, or their bone growth will not be proper because of that steroid. So the answer to that is that if you don't take that inhalational corticosteroid, there is a high risk that child may exacerbate, and because of that exacerbation, it causes more stress and causes more chance of stunted height or retarded growth or delayed milestones. So it's mandatory for them also to take. So the bottom line is that we need to be consistent in having inhaler dosage with proper technique so that asthma is controlled. This is regarding symptom control. The second most important point is regarding allergen avoidance. So regarding allergen avoidance, there are tests to diagnose it. There is some blood test which is done in serum, or there is a allergy skin test where you need to put your allergens on your forearm and then you check how are your allergens and then what kind of allergy you have, and you try to avoid it. The most common allergen being dust mite. So how do we avoid dust mite? By simple means that we already do that: changing your bed sheets every second or third day, making it, washing it in warm or hot water, changing your curtains every 15 days, not to use sofa cover, not to use carpet, try to stay avoid from pets, not to use strong scents or perfume, not to use candlesticks, and the most important part of is to have a healthy lifestyle and to avoid at any cost smoking. Smoking is such a rampant thing that it is estimated that around 4.5 to 5 lakh of deaths, they happen directly because of smoking or smoking related elements. So it's a huge number when you put it in perspective in all the diseases, because from hair till nails, from appendage to the periphery, it involves all the organs and causes damage to all organs, predominantly the lungs. So how do we avoid smoking? Smoking avoidance is a different chapter, but to make it simple, establish a quit rhythm, quit pattern, establish a date, declare that I'm going to quit on that date, try to abstain it. If you are recurrently having cravings, try to seek professional help, involve your family, involve your friends, try to avoid friends or other companions or colleagues who are usual smokers. And lastly, if you determine that you are able to quit and you will abstain from smoking, there are more chances. The first step is to declare that I will try to avoid smoke. and that's how you do about it. So that is one of the important step in asthma management, is that to have a healthy lifestyle, proper diet, nutrition, with 20 minutes at least exercise, allergen avoidance, and symptom control. The final point which I want to make it about is that vaccination. So, regarding vaccination, the vaccine which we have available is a swine flu vaccine, H1N1 vaccine. So, asthmatic patients are slightly at a higher risk of developing pneumonias. So, it is usual practice to give, not a mandatory practice, a usual practice to give influenza vaccine once every year. And additionally, you can take also pneumonia vaccines apart from that, which may help you to prevent pneumonias in future. Because there is some added risk that if you are taking additional corticosteroid dosage daily, there is somewhat increased risk of pneumonia. However, the risk versus benefit ratio tells you that the benefits are way more than the risk, so it is mandatory to take inhalers. To summarize what we have discussed today is that asthma is a very docile looking disease. However, it can turn into grave disease if not controlled early or diagnosed early. Asthma, it is characterized by cough, chest tightness, breathing difficulty, and wheezing, which vary over time and place. The earlier the diagnosis, better is the treatment and better is your lung health. The cornerstones of asthma is symptom control by use of inhalers, allergen avoidance, healthy lifestyle, diet and exercise, and vaccination. These are the cornerstones of management of asthma. Finally, the point to note is that strongly advise someone to stop smoking tobacco related products or alcohol and to have healthy lifestyle. Regarding any future directives which we have, usually in severe asthma which are not controlled with inhalers, we have something known as biological injections, which are new in this market, not new, quite 2 decades now, but new injections are also coming. They are costly, but whenever patient is not controlled adequately on high dose of inhalation corticosteroids or oral steroids, usually these are the candidates for further management with biological injections. So that's all I want to tell you about asthma. So if we have questions, we can take it. Right. So we have some questions. Who is more prone to get asthma? So the risk factors for asthma are varied. There is no conclusive factor that these individuals will develop asthma, but maternal history of smoking, predelication, genetic predelication that your father, mother, or someone in your family is having asthma, or patients who are having some hazardous occupations that is known as occupational asthma, some exposure to dyes, chemicals, those are also risk factors for asthma. So these are the people who are more prone to get asthma. So which time is difficult for patient in year? So it varies that most of the individuals will have winter exacerbation. Most people will have winter exacerbation. The months such as from September, October till Jan, Feb are difficult time of year for these patients. But there are also some people who exacerbate in summer. They usually have allergy to pollen grains and some other uh, flowering plants which are there in summer season. So it varies as per the individual. But the most of the individuals will have difficulty during winter season. Right. Next question. So, is there a risk that asthma will get worse with age and can lead to mortality? So, usually, if not taken care, the asthma tends to grow with age. And if you are having recurrent exacerbation and you are not taking inhalers properly, then the morbidity is increased. And yes, definitely the mortality is increased. So it's quite painful to know that the asthma, which is a treatable condition, you have simple technology like inhaler usage, you can prevent exacerbation, and still there are around 3.5 to 4 lakh deaths per year in whole world because of this not taking of inhalers. Is there any kind, is there anything like acute asthma or it's always chronic? So asthma is a long-standing disorder. It's usually characterized like a chronic airway lung obstruction disease, but that's a different entity at all. Usually smokers usually get that, which is known as COPD, chronic obstructive pulmonary disease. What is known as acute asthma, it is simply you put it as it is acute exacerbation of asthma or acute severe asthma. So whenever patient is not taking inhalers or patient is having first time manifestation or symptoms, usually lands up in emergency department having difficulty in breathing, having decreased oxygen saturation, having chest tightness, and having perspiration and varied BP. So that is known as acute asthma. So yeah. Next question. Are there things I can change in my life to reduce my risk of an asthma attack? Yeah. So as we have discussed that proper lifestyle, like proper meal times, proper sleep times, getting up in morning and then doing your exercise, whatever exercise it is. So simply put, if your age is around 30, so 180 minus 30, it is 150. So whatever the number, 180 minus the number of your years, that should be your target heart rate, and you should try to achieve that. And daily at least 20 to 25 minutes of exercise will reduce your risk of asthma attack. Apart from that, allergen avoidance and environmental triggers, whichever possible, we can avoid use of mask during driving, if you're especially driving a two-wheeler or going at some high hazardous places where the exposure of noxious gases is more. Try to use mask, preferably a 995, that will reduce your risk of asthma attack. Okay. Asthma preventive vaccination needs to be taken yearly or once will be enough. So influenza, excellent question. So influenza vaccine is to be taken every year. The strains of influenza, they get updated every year. So influenza vaccine is to be taken every year. The other vaccine, which is pneumonia vaccine, there are different strains available. In India, there is available which is 13 and 23. In foreign, the other strains are also available, 21 and other things. But pneumonia vaccines can be taken once, the one strain, and the second strain the next year. Maybe you can repeat a booster after 5 years, but for influenza, you need to take it every year. Okay. If asthma attack happens and no hospital facilities available, then what is first treatment? So if asthma attack happens and if you are very sure and you are diagnosed clinically that it is asthma, patient is wheezing very badly, patient is having low oxygen saturation, the first and foremost to do is that give oxygen, number one, if it is available. If it is not available, try to give reliever medication. Reliever medication can be delivered better with nebulization because patient will not be able to inhale properly. So nebulization with short-acting bronchodilators like salbutamol, or maybe anticholinergics also you can add salbutamol and ipratropium combination you can give. And the basic cornerstone of this is to curb the inflammation, and the most potent drug for curbing inflammation is steroid. So rapidly acting short acting hydrocortisone, so IV hydrocortisone, oxygen, short acting nebulizations will be your first line of treatment for asthma attack. Any local treatment or like Gharelu Upay or treatment is available for asthma? So there is unfortunately no Gharelu treatment or something like that Upay for asthma. It's a proper disease. Patient usually feels that this is something in my head. I'm having asthma and I need to take inhaler. It is something like a habit for me. So it's not a habit. It's not something which is like a trickery or a mockery or something like that. It's the actual disease which needs a proper evaluation and proper diagnosis. And local treatment, you only local treatment which can be there is allergen avoidance. So you can keep your house and other environment clean, your workplace and office clean. But apart from that, I think we need a proper professional consultation with evaluation and diagnosis of asthma. Okay, what kind of test will be needed to monitor asthma? So once we have diagnosed patient as asthma, we try to give something known as asthma diary. In that asthma diary, we try to ask patient to daily do recording of their lung function. there is a device known as peak expiratory flow meter, in which you have to blow and you get readings that how much are your readings, 200, 300, 400, whatever are your readings. You try to document it in your diary. Whenever you have increased symptoms and the values come down, try to increase your dose of inhaler and document it. Then your doctor can prepare a proper action plan that your if your peak flow meters are from this to this much, you can adjust your dosage accordingly. That will reduce your hospital visits also and will give you more confidence about your own disease. It's like a simple thermometer measurement for your fever. Similarly, you have a peak expiratory flow meter for your asthma control. So whenever you go and seek your medical advice, do ask for peak expiratory flow meter monitoring and then get an action plan done from your doctor. I'm allergic to dust. Does it lead to get asthma as ages? So not necessarily. The data which suggests is that around 30% of patients who are having allergy to dust usually develop asthma. So majority of patients usually don't develop asthma over their age. But yes, you need to be cautious. You need to seek professional help that whether your asthma is severe or not. Most of the patients will have mild intermittent symptoms of asthma which may not even require inhalers or which may require inhalers as and when required. So if you have allergy to dust, you are more prone to develop asthma, but this is not a necessary case that if you are allergic to dust, you will definitely develop asthma. But yes, you are at risk to develop asthma. What all is known about asthma? So, regarding asthma, we know that the disease, we don't know why it happens to particular individual. We don't know why it only affects some family members and it does not affect why it is happening even if you don't have any family history, still it develops. We don't know what there are many things regarding asthma that we don't know, but what we know definitely is as for asthma is that it's a very common problem and it's a treatable problem. So inhalers are the cornerstone of asthma. So proper inhaler technique with regular dosage is mandatory for asthma. Right? Does asthma get cured by yoga and exercise? Yeah, wonderful point. So there was a study done by AIMS Delhi in which they gave inhalers and then which one arm they give inhalers and one arm they give inhalers and yoga and exercises. And they found that the patients who are taking inhalers and also doing yoga and exercises are having better lung function and better lung health and less chance of exacerbation. So yeah, so asthma, yoga and exercises do help in asthma, but they have to be added with your inhalers. So you cannot skip your inhalers and only do exercise, or you cannot do only take inhalers and skip your exercise. Both go hand in hand. Okay. All right. So I think we have covered all the questions, and the questions are wonderful. So yeah. So final words on asthma is that please try to take your good care of your health. We are what we breathe. So lung is the only organ which is exposed directly to internal and external environment. The point of this conversation and this discussion was to sensitize you regarding asthma, which is a common problem, and how we can early diagnose it and how we can treat it. The best thing which one can do is that treat your body like a temple, take good care of it, do regular exercise, stay away from addiction, stay away from smoking, stay away from alcohol, and daily exercise with healthy habits will definitely keep you away from asthma and other elements as well. I think we'll take this final question and we'll wrap it. Does it affect an individual who is under stress mentally and having asthma? Definitely. So depression and other psychosocial elements and mental stress definitely add to asthma. It's one of the risk factor along with other things like GERD, gastrointestinal reflux disorder, mental stress, and other factors. They affect individuals and it gets added with asthma, which can act a possible trigger. A mental stress can act as a possible trigger in asthma. So definitely, it does affect. So it's like a snake with its tail in its mouth. So stress can cause asthma, and asthma can increase stress. It's like that. Right. Okay. Thank you so much. Thank you. Thank you for your time. Thank you for your patient listening.